Dear patient, within the following minutes we will inform you about all important aspects of a gastroscopy. For example, the procedure and possible clinical pictures. Your attending physician will discuss all your questions and possible risks of the examination. The gastroscopy is used for exploration of the upper gastrointestinal tract. It enables the physician to detect conditions that are causing your symptoms and to identify potential pathological findings and provide treatment. Despite the physician's high diligence, there may be complications in individual cases. Nevertheless, a gastroscopy is a low-risk intervention. The upper gastrointestinal tract is responsible for ingestion of food, breaking it down into smaller pieces, delivery, and utilization. The main parts of the upper gastrointestinal tract are palate, pharynx, esophagus, stomach, pancreas, liver, gallbladder, and duodenum. Though pancreas, liver, and gallbladder are not endoscopically imaged. The procedure takes only a few minutes and is to a large degree painless. To unfold the organs, air is inflated. This procedure and the actual intervention can cause discomfort. If you wish, you may receive an injection for anesthesia or mild sedation, so you can oversleep the intervention. The endoscopist may numb the back of your throat by spraying on some local anesthetic and prevent choking. The examination is performed by using a thin, flexible, fiber optic endoscope. The instrument has the diameter of a small finger. It is used for the examination of cavities within the body. The esophagus, the stomach, and the first centimeters of the duodenum are examined. A lubricant supports the procedure. The endoscope has a variety of functions. The fiber optics enable the endoscopist to view the images on a TV screen. Furthermore, the endoscope has a rinsing device for keeping the optic clean, a light source, and channels through which various tools can be inserted. It allows the physician to take tissue samples of the mucous membrane or to accomplish minor surgical procedures. It is important to have a clear view on the examined organs. Therefore, you should not eat or drink for 5 hours before the test. A bowel aperient as used before colonoscopy is not necessary before gastroscopy. Medication that increases the risk of bleeding must be paused at least 5 days prior to the examination. You should talk to your physician about your individual medication. The gastroscopist detects pathological conditions of the upper gastrointestinal mucosa, which may often be treated directly. Possible findings can be polyps, gastritis, gastric and duodenal ulcer, food intolerance, gastroesophageal reflux, or stomach cancer. Elderly people commonly develop polyps. These are benign neoplasms of the mucous membrane. Polyps are harmless, but in some cases they might be a primary stage of stomach cancer and should therefore be removed endoscopically and be examined histologically. After injecting a drug, flat polyps are lifted and can be removed by using an electric loop. The area won't bleed after that. Gastroesophageal reflux is better known as heartburn. Because of a malfunction of the upper gastral sphincter, sour gastric acid can flow back into the esophagus and irritate its mucosa. In chronic course of disease, the affected cells can degenerate into esophageal cancer. A complication of chronic reflux esophagitis is Barrett's esophagus. A chronic reflux can degenerate the tissue of the lower end of the esophagus and can shorten it from the inside. In this process, characteristic red tongues surround the complete circumference of the esophagus. Although only in rare cases malign tumors develop out of a Barrett's esophagus, the disease should be monitored endoscopically at a regular basis. In the result of gastritis, the gastral mucosa is damaged. Because of the reduced production of mucus, the aggressive gastric acid may irritate and damage the gastric wall. In most cases, a gastritis is caused by a bacteria called Helicobacter pylori. Often a gastritis completely heals up, but sometimes in a chronic course it may develop a stomach or duodenal ulcer. In about 75% of all stomach ulcers and nearly all duodenal ulcers, Helicobacter pylori can be detected. Treatment with antibiotics and other medication is very effective. A common kind of food intolerance is celiac disease. This is partly a genetically caused intolerance against gluten, which is part of various kinds of grain. It is a chronic disease of the duodenal mucosa that can't be treated causally. Celiac disease can be treated by lifelong abdication of gluten. If celiac disease is suspected, it can be diagnosed by a small bowel tissue sample during endoscopy. Possible fatigue is normal. After short anesthesia, sedation, or other medication, you will be monitored by qualified medical staff until your organ functions have normalized. Difficulty swallowing, minor urge to gag, or flatulence will vanish after a short time and are mostly harmless. If you did receive tranquilizers or pain medication, short anesthesia, or sedatives, you may not eat or drink for at least 1 hour after the gastroscopy. Please talk to your physician about your food intake and medication. If you get outpatient treatment, you will need somebody to accompany you home and to stay with you until the effects have fully worn off. If you have had a sedative and pain medication or short anesthesia, you must not drive for 24 hours. You should not make important decisions and avoid risky activities. In any case, don't drink or smoke. If your state of health worsens and you suffer vertigo, stomach ache, attacks of sweating, nausea, blood vomiting, or losing blood from the anus, immediately contact your physician or a hospital nearby. Your physician will inform you about the possible follow-up treatment and possible risks of the procedure. Your medical staff thanks you very much for your attention and is now available for all your questions.